Total confirmed cases of COVID-19 stand at 14,378 with 480 deaths, 1,991 recoveries. "21 Navy personnel test positive for COVID-19 at Naval Shore Establishment in Mumbai. Most are asymptomatic and have been traced to a single sailor who tested positive on the 7th of April. COVID-19 cases continue to spiral globally with more than 22 lakh cases. More than 1.5 lakhs have succumbed to the disease. US coronavirus death toll crosses 37,000. Total number of cases in the United States crosses 7 lakhs. Hello and welcome to this edition of the news. I'm Rukma in our top story. According to the Ministry of Health and Family Welfare's latest data, total confirmed cases of COVID-19 in the country stand at 14,378, whereas active COVID-19 cases in India stand at 11,906. 480 people have succumbed to the illness so far, while 1,991 have recovered. And a total of 21 serving personnel of the Indian Navy have tested positive for COVID-19 within the premises at Mumbai. This number includes 20 sailors of INS Angre, a shore establishment in the city. Most of these are asymptomatic and have been traced to a single sailor who tested positive on the 7th of April. They all reside in the same accommodation block at INS Angre. All primary contacts, though asymptomatic, were tested for COVID-19. The entire in-living block was immediately put under quarantine, containment zone, and INS Angre 2 is under lockdown. All action as per established COVID-19 protocol has been taken. There are no cases of infection on board ships and submarines. The Indian Navy continues to actively support the national effort in the fight against COVID-19. The Union Ministry of Health and Family Welfare has informed that the Red Cross Society has started a 24/7 control room for blood services in Delhi. Anyone who needs blood or wishes to donate may call at these helpline numbers, which are 011-233-59379, 9319982-104 and 9319982-105. And Prime Minister Narendra Modi continues to engage with world leaders on ways to tackle COVID-19. He had a telephone conversation yesterday with Cyril Ramaphosa, President of the Republic of South Africa. The two leaders exchanged views about the domestic, regional and global challenges posed by the COVID-19 pandemic. The Prime Minister assured that India would provide all possible support to South Africa to ensure supplies of essential medicines during this challenging time. PM Modi commended the proactive role being played by President Ramaphosa in his current capacity as the chair of the African Union to coordinate a continent-wide response to the pandemic. Evoking the centuries-old ties of friendship and people-to-people exchanges between India and Africa, PM Modi conveyed India's full support for the joint African effort against the virus. In a tweet, the Prime Minister said had a good discussion with President Cyril Ramaphosa about the COVID-19 challenge. And he also had a conversation with Abdel Fattah al-Sisi, President of Egypt. The leaders discussed the evolving global situation in the wake of the COVID-19 pandemic and exchanged information about the steps being taken by their respective governments to protect their populations. PM Modi assured the Egyptian president that India would provide all possible support to ensure availability of pharmaceutical supplies during these difficult times. He also thanked President al-Sisi for the support being provided to Indian citizens present in Egypt. The two leaders agreed that their teams would remain in touch to ensure close coordination and experience sharing. In the wake of the continuing COVID-19 outbreak in the country, Union Ministry for Home Affairs has decided to extend the suspension of all existing visas granted to foreigners except for those belonging to diplomatic, official, UN or international organizations, employment and project categories till 3rd May 2020. The MHA has further directed that all incoming passenger traffic into India through any of the 107 immigration checkposts will remain suspended till May 3rd, 2020. However, no such restriction would apply to vehicles, planes, ships, conveyance, trains, etc. carrying any goods or supplies, whether essential or non-essential. Regular visa, e-visa or stay stipulation of such foreign nationals who have been stranded in India because of spread of COVID-19 in many parts of the world and also due to travel restrictions imposed by the Indian authorities and whose visas have expired or would be expiring during the period from 1st February 2020 midnight to 3rd May 2020 midnight would be extended till midnight of 3rd May 2020 on gratis basis after making online application by the foreigner. And a meeting of the group of ministers GOM over COVID-19 in the country is underway at Defence Minister Rajnath Singh's residence. And movement of persons allowed after April 20th is as follows. Private vehicles for medical emergency services and for procuring essential commodities. In case of four-wheeler, one passenger in the back seat besides driver is permitted. In case of two-wheelers, only driver of the vehicle is permitted. And let's take a look at the guidelines issued by the ministry for citizens venturing into public spaces. Wearing face cover, practice social distancing, gathering of over 5 persons in public places prohibited, marriage and funerals to be regulated by DM's office, strict ban on sale of liquor, gutka and tobacco. Let's take a look at the industrial establishments allowed to operate after the 20th of April. Industries in rural areas, SEZ, export-oriented units, industrial estates, industrial townships. Manufacturing units of essential goods, IT, hardware, food processing units, jute industries, coal and mineral production and ONG refinery, that's oil and gas refinery, brick kilns in rural areas, construction activities including roads, irrigation, renewable energy, construction projects in municipalities. And as cases of coronavirus soar across the country, so is the demand for sanitizers. Masks and other necessary items cited as preventive measures to contain the virus. In Haryana's Panipat, a factory under the name the Panipat Sugar Mills Limited has started producing hand sanitizers. The mill, which comes under Haryana Sugar Fed, provides a 180 milliliter bottle of sanitizer at 45 rupees. However, a 1 liter bottle costs around 200 rupees. And under the Pradhan Mantri Garib Kalyan Yojana, wheat and pulses are being distributed among the poor in different areas in Chandigarh. So far, 3,000 families have benefited during the lockdown in Ram Darbar, Shantinagar, Vikas Nagar areas. People thank the Prime Minister for this relief.
यहाँ पे राशन जो डिस्ट्रीब्यूट कर रहे हैं, आज की डेट का जो है 242 परिवारों को राशन बांट चुके हैं और हम अपने मोबाइल ऐप है हमारे पास, उसमें हम कस्टमर का आधार कार्ड नंबर डालते हैं, उसकी डिटेल शो हो जाती है और उसमें पूरी डिटेल आ जाती है किसको कितना राशन देना है और उसके बाद हम उसको सबमिट करके राशन डिस्ट्रीब्यूट कर देते हैं।
सरकार की तरफ से फ्री राशन दिया जा रहा है। ये लॉकडाउन के प्रति सरकार की तरफ से बहुत अच्छा काम हो रहा है।
जो प्रधानमंत्री जी द्वारा शुरुआत की गई है कि प्रति जो गरीब लोग हैं उनको 15 किलो गेहूं और 3 किलो दाल 3 महीने का जो मिल रहा राशन वो भी बिना पैसे दिए, तो ये एक बहुत ही अच्छी योजना है हमारे प्रधानमंत्री जी द्वारा।
हम बहुत शुक्रगुजार हैं प्रधानमंत्री का, जिन्होंने ये योजना रखी है जिसके तहत हमारे को ये राशन है वो दिया जा रहा है। क्योंकि आजकल के जैसा टाइम है, कोरोना के करके सब लोग घर में बैठे हैं, जो मज़दूर लोग हैं वो नहीं कमा सकते हैं, तो बहुत बहुत धन्यवाद करते हैं उन लोगों का जो हमारे को ये सब चीज़ें प्रोवाइड कर रहे हैं।
हमें आज प्रधानमंत्री गरीब अन्न कल्याण योजना के तहत यहाँ पे गेहूं और दाल फ्री में बांटी गई है। हम प्रधानमंत्री जी के तहे दिल से शुक्रगुजार हैं कि उन्होंने ऐसे कोरोना के टाइम पे गरीब लोगों की सहायता की है।
And amidst the COVID-19 outbreak in the country, fake news is also seeing a surge. Time for a fact check on one such piece of information. A section of the media carried reports that a consignment of test kits from ICMR meant for Srinagar were diverted to Jammu. The report is fake. Authorities denied reports quoting Dr. Samia Rashid, Principal GMC Srinagar, who confirmed that there is no truth in the news report that testing kit consignment was diverted to Jammu. She said that the consignment was first delivered in Jammu and the next day it was received in Srinagar. Principal Government Medical College Srinagar also asserted that there was no interruption in the testing process because of a shortage of testing kits, and there were presently 2 testing centers in the valley at GMC Srinagar and SKIMS in Sura. The 3rd testing center is being established in the Jhelum Valley Medical College in Bemina. Doctors at SKIMS have also confirmed they are not facing any shortage of test kits and have ramped up the number of tests to 1,000 per day. It was clarified that Dr. Jitendra Mehta, Divisional Officer NHM, has been actively involved in COVID-19 mitigation and management, and he had arranged an engineer from Delhi for testing labs. With the help of the engineer, 10 PCR machines have been calibrated, with which the testing capacity has increased from around 200 to more than 800 tests per day. Dr. Samir Mattu, Director Health Services Kashmir, said that the department has been carrying out sample collection across the valley aggressively at designated sample collection centers. He denied reports that sample collection had been affected due to shortage of testing kits. In Jammu, the CRPF's Madadgar carried out relief work in the red zone area of Tikri and distributed sanitizers, masks and other sanitation items in the wake of the novel coronavirus outbreak. The paramilitary force handed the items to 6 sarpanchas and panchas of the area of the district. The country's largest paramilitary force is adopting villages and localities in their vicinity so as to take care of the basic necessities of locals like ration, medicines and masks during the ongoing lockdown period. And talking to DD News, Deputy Commandant of the unit said that CRPF always stands shoulder to shoulder with the people in every testing time.
नाम का ज़्यादा प्रभाव है। इस प्रभाव से कम करने के लिए सीआरपीएफ के द्वारा सैनिटाइजर्स आइटम बांटे गए हैं, जिसके अंदर नैपकिन दिए गए हैं, सैनिटाइजर्स दिए जा रहे हैं, कुछ सॉप्स दिए जा रहे हैं। इसी प्रकार से यहाँ की जो स्थानीय जनता है, इसको भी समय समय के ऊपर मार्गदर्शन, गाइडलाइंस और अवेयरनेस पैदा की गई है, जिसमें इनको ये बताया जा रहा है कि सबसे पहला काम है आप लोगों को सोशल डिस्टेंसिंग मेंटेन करना।
And in other news, Vice President Venkaiah Naidu has greeted the nation on the occasion of World Heritage Day. On this important day, he said, "Let us make a strong resolve to protect and preserve our heritage, culture and all the monuments that stand as testimony to our glorious past. We must remember the fact that heritage is the shared wealth of humanity, and there is a need to increase awareness of India's rich heritage, tradition and vibrant culture among all. I call upon the youth of the country to make productive use of this lockdown period by enhancing their knowledge on our great heritage. And in Nepal, the number of coronavirus cases has jumped to 30 after 14 more people tested positive yesterday. According to the Ministry of Health and Population, 12 persons from Udaipur district and 2 from Chitwan tested positive for the deadly virus. The number of infections in the Himalayan nation climbed to 30 from just 16 in a single day. The Ministry of Health and Population spokesperson has said that 4,822 tests were conducted in the past 24 hours and a total of 24,253 tests have been conducted so far. He said 90 people have been kept under isolation while 4,607 have been quarantined. Bangladesh will operate 8 special flights to bring back Bangladeshi citizens stranded in India. The private US Bangla Airlines on Friday announced that it will operate these flights on the Chennai-Dhaka and Kolkata-Dhaka routes between April 20th to the 25th to bring back over 1,000 Bangladeshi citizens from India. 6 of these special chartered flights will operate from Chennai to Dhaka and 2 from Kolkata to Dhaka. The airlines will operate daily flights from Chennai starting from 20th April till the 25th. The airlines has announced that the flight will take off from Chennai at 12:15 p.m. Flights from Kolkata will take off at 11:30 a.m. on April 21st and 23rd. Earlier, the Foreign Ministry of Bangladesh had said that nearly 2,500 Bangladeshi citizens, including 1,000 students, are currently stranded in India due to the corona outbreak. And the coronavirus outbreak has infected over 22 lakh people worldwide, while over 1,53,000 deaths have been reported so far. The US has the highest number of cases and deaths worldwide, over 7 lakh confirmed infections and over 37,000 deaths. Following the announcement of reopening guidelines, governors from Michigan, Ohio, Wisconsin, Minnesota, Illinois, Indiana and Kentucky have formed a partnership to work together on restarting the economies in their states. States collectively account for about 16% of the total US economic output. However, in another major announcement, US President Donald Trump announced a $19 billion relief program to help farmers cope with the impact of the coronavirus pandemic through a package that will include direct payment and mass purchases of produce, meat and other products. San Francisco, meanwhile, opened a new COVID-19 testing site as part of California's efforts to boost testing capacity ahead of any potential reopening of the economy. The site, dubbed City Test SF Soma, features a screening section to double-check drivers coming in to have appointments and a swab section for medical personnel to conduct the nasal swab tests. The new site comes after California Governor Gavin Newsom announced a framework which would guide his decisions on how to reopen the economy, which has been shuttered in California and across the nation as a result of the novel coronavirus. Indian authorities' decision to provide Russia with medicines to combat coronavirus is in line with the spirit of partnership between the two countries, Kremlin spokesman Dmitry Peskov said on Friday. In a tweet, he said Moscow is pleased with the Indian government's decision to send a shipment of medicines to combat the coronavirus to Russia and is grateful for it. He pointed out. Peskov added that they considered Indian colleagues' decision to be an effective step to implement the agreements on cooperation in the fight against the new infection that Russian President Vladimir Putin and Indian Prime Minister Narendra Modi reached in a telephone call on the 25th of March. In Moscow, hospitals are preparing for their toughest 2 weeks as the country's coronavirus cases soar. The government has rushed to build a new hospital and repurpose existing ones after the Ministry of Health warned that beds were running out.
Russia is now the fastest growing coronavirus outbreak in the world, with more than 4,000 new cases every day, and how the tone of the authorities has changed in the last few weeks, from just over a month ago with President Putin saying that the situation is under control, to the last few days when the Kremlin has said that hospitals are going to be pushed to their limits. The Ministry of Health says the hospitals do have enough equipment, they do have enough staff, but not enough beds. And so they are desperately trying to open or transfer other hospitals into coronavirus centres. We've also spoken to the Doctors Alliance, a union here that's very critical of the government. They say there simply isn't enough oxygen, there's not enough staff. They know of doctors and nurses who are already dying, people in beds, in queues, in corridors who are also not getting the treatment they need. So a mixed picture, but I think what is not under any debate is that Russia is fast becoming one of the most urgent stories when it comes to COVID-19.
And Italian health officials declared a long-sought victory over the coronavirus in poorer southern regions. Prime Minister Giuseppe Conte had warned 6 weeks ago that Italy's ability to conquer COVID-19 depended on whether cases can stay largely contained to its northern epicenter around Milan. Meanwhile, deaths from the virus in Italy rose by 575, while the number of new cases declined slightly, and scientists warned that infections were now mainly happening among family members. The official death toll since the outbreak came to light on the 21st of February has risen to 22,745, the Civil Protection Agency said, the second highest in the world after that of the United States. However, the Italian authorities acknowledged that the true number of fatalities is much higher. And the Islamic Affairs and Charitable Activities Department of the Dubai government on Friday announced that Muslims can offer Taraweeh prayers at home during the holy month of Ramadan, like the 5 daily obligatory prayers. The department in a statement said that prayers should be done at homes, offered at homes, as mosques are closed as part of the country's efforts to fight the COVID-19 pandemic. France registered 761 more deaths from coronavirus, bringing the total to 18,703, the fourth highest tally in the world. But the number of people in hospital has declined for a third day running. And in another sign that the lockdown put in place a month ago is working, French public health authorities said the total people in intensive care units fell for the 9th day in a row at 6,027, a low point since April 1st. At 18,681, the number of fatalities is up 4.2% over 24 hours, with the rate of increase decelerating for the second day running. And the UK has launched a new coronavirus task force to support efforts to make a vaccine available to the public as quickly as possible. However, the British government did not give more details on an expected timetable for development. It said 21 new research projects would get funding from a £14 million investment pool to rapidly progress treatments and vaccines. Officials also said that it would identify ways to fast-track clinical trials and also continue to support international efforts to find a vaccine. The UK has registered 14,576 deaths so far and has more than 1 lakh active cases. And Iran on Friday paraded disinfection vehicles, mobile hospitals and other medical equipment as it marked its National Army Day. The Defenders of the Homeland, Helpers of Health Army Parade was held at a training center before a group of commanders in face masks to underscore the military's role in battling the coronavirus pandemic. Iran is West Asia's worst hit country by COVID-19. 4,958 people have lost their lives so far in Iran. And Argentina is turning a massive exhibition space meant to provide a platform for music and sports events into a center where people with COVID-19 will be treated. The exhibition hall is being transformed into a place where some 2,500 people with less severe cases of COVID-19 will be treated. The initiative is taken in order to lighten the burden on hospitals where moderate and severe cases will be admitted. Argentina has recorded 2,669 confirmed cases of the virus as of Friday. 123 people have died due to COVID-19 so far. And in Spain, residents in central Barcelona hosted a balcony party to boost morale during the coronavirus lockdown. For the third week in a row, neighbors from a block of flats took to their balconies to dance and sing. The party started off as a spontaneous event sparked by social networks and equivalent events seen in the news. Party was interrupted in the evening briefly by local police, who were responding to noise complaints from other residents. While sticking to the tally, Spain registers an overnight figure of more than 900 at the height of the outbreak, among countries worst hit by the virus which causes respiratory disease. COVID-19. Spanish Health Emergency Chief Fernando Simon has said the country is following World Health Organization guidelines by just including people proven to have contracted the virus in the nationwide death toll. Although the country has begun to ease a strict lockdown imposed on March 14, opening up some sectors of the economy, including manufacturing, this week. And with that, we wind up this edition of the news. News and updates continue on DD News and DD India. Namaskar.